Okay, chronic degenerative disorders. One of the big ones you see is multiple sclerosis, where there's progressive demyelinization of neurons in the brain, the spinal cord, the cranial nerves. My roommate's mother in nursing school had this. There are different types of MS, and they vary in effect, severity, and progression. Terry Garr is a famous person I know who has MS. Uh, Ozzy Osbourne's son has MS. So there are several people that have this. The loss of myelin interferes with the conduction of impulses, and with that loss of impulse, then lots of different things are affected. Um, Earliest lesions, we're talking about a loss of myelin in the white matter of the brain, the spinal cord, maybe an inflammatory process. Plaques vary in size and may coalesce into a single patch. There are larger areas of inflammation, larger areas of demyelinization, and usually they develop later and become very visible. Recurrence. Initial inflammation may subside. It's almost like they go into a remission, if you will. Neural function may return to normal for a while. In time, that neurodegeneration does become irreversible, and it won't come back. The function will be lost permanently. The periods of remission get shorter, and more severe symptoms when they return. Each recurrence causes additional areas of the CNS to be affected, and it is varied in severity. Onset is usually between 20 and 40 years of age. Some people don't realize they have this. And so I think my roommate's mother was diagnosed in college or right after college. Um, the cause is unknown. It could be an autoimmune disease. It could be a nutritional deficit. It may be a change in blood flow to the neurons. Um, don't know. It may have genetic, environmental components, immunological components. There's an increased risk in families of affected individuals. The signs and symptoms vary really by person, and it's determined by where the demyelinization occurs. Blurred vision, weak legs, double vision, scotoma, where there's a spot in the visual field, dysarthria, paresthesia, there's numbness, burning, tingling. There may be progressive weakness and paralysis extending to the upper limbs, and loss finally of coordination, bowel and bladder function, sexual dysfunction, chronic fatigue. All of these things you think about with multiple sclerosis. There is no definitive test for MS. An MRI can help with diagnosis and with monitoring the progress of the disease. The treatment is, again, there's no definitive treatment. There's lots of research going on, lots of trial drugs, even. And so, right now, physical therapy, occupational therapy, finding ways to adapt to the loss, everything is kind of individually done. Parkinson's disease. Parkinson's is a progressive degenerative disorder also. Dysfunction of the extrapyramidal motor system. It is a progressive degeneration in the basal nuclei, and there's an imbalance between excitation and inhibition in the basal nuclei, which is what you're going to see then. That excess is what affects movement and posture. The most famous person I know right now with Parkinson's is Michael J. Fox. And so you may have seen him in television shows and whatnot with his Parkinson's. and the tremors and the jerking movements that he shows. Resting tremors, muscular rigidity, difficulty initiating movement. He defines it as just frozen, and postural inability. There's primary, which is the idiopathic kind. Us idiots don't know the pathology, which usually develops after age 60. I believe this is what Michael J. Fox has, even though his developed very young. It's very unusual. Secondary Parkinsonism is caused by encephalitis, trauma, vascular disease, or certain drugs. Early signs and symptoms are fatigue, muscle weakness and aches, decreased flexibility. There's less spontaneous change in facial expression. There may be tremors in the hands, a peel rolling motion of the hands. Later, the tremors will affect more the hands, the feet, the face, the tongue, the lips. Muscles become rigid or frozen so that it's hard to start a movement. It's hard to make it get going. Movements will be slow, and there may not be any involuntary movements, or at least a lack of associated involuntary movements. Their posture is going to be one that is stooped over, leaning forward. And the gait is a propulsive one. They're propelled forward. Everything becomes slower and more difficult in terms of activities, the more complex they are. Other functions that are affected. Inflection of the voice. So they may not be able to share expression of feeling and emotion. The voice will be low. There will be dysarthria. Chewing and swallowing become more difficult. It takes longer to eat, and they may drool because they can't swallow or control their lips or tongue to lick and keep from drooling. Their face might resemble a mask. That's that inability to move, that frozen, a blank staring face, impaired communication, obviously. Other functions that are affected, urinary retention and constipation related to autonomic dysfunction, orthostatic hypotension, so that falls are problematic, urinary tract infections, obviously with retention you would worry about that, respiratory tract infections, again because the muscles aren't working properly to fully expand the lungs. And dementia develops late in the course of the disease. Treatment, if there is a cause, we can remove it. Dopamine replacement therapy, anticholinergic therapy, speech, language, physical, occupational therapies all come into play for these patients with Parkinson's. There needs to be close monitoring of the urinary tract and the respiratory system and GI as well. Forgive me, sorry. Amyotrophic lateral sclerosis is called ALS, and this is Lou Gehrig's disease. There is no identified cause, but we know now that there are genes on different chromosomes that have been linked to this disease. It's another progressive degenerative disease. It affects the upper motor neurons in the cerebral cortex and the lower motor neurons in the brainstem and spinal cord. There's no indication of inflammation around the nerves, but cognition is also impaired. Loss of upper motor neurons in the cerebral cortex, where there's a spastic paralysis and a hyperreflexia. With the lower motor neurons, you're going to see that flaccid paralysis and decreased muscle tone and reflexes. Muscle weakness and loss of fine motor coordination is progressive. Stumbling and falls are common. Death occurs usually because of the respiratory failure. Treatment is nonspecific. Anything that they can do to slow the degeneration process. Stem cell therapy has been used with some limited success, and that's certainly being studied. There are some drugs that can be given to slow damage to the neurons, and those have been tried. Moderate exercise and rest. Obviously, respiratory therapy to keep those lungs clean and functioning. Good nutrition. All the therapies, and even psychological therapy and behavior therapy. Myasthenia gravis is an autoimmune disorder. Autoantibodies to acetylcholine receptors form. There is destruction of the receptor site, prevention of further muscle stimulation, skeletal muscle weakness. Facial and ocular muscles are usually affected first. But for myasthenia gravis, be sure to understand that dysphagia and aspiration are very real and very significant problems. So these both need to be watched very carefully. These folks need to be watched when they're drinking, when they're eating, for any kind of problem. Diagnostic tests are the electromyography and a serum antibody test. The signs and symptoms are listed for you here. You can see, is there anything that wouldn't make sense to you? Muscle weakness, impaired vision. The monotone speech, where again there's no inflection there. Difficulty chewing and swallowing, we talked about that, and the dysphagia. The heads droop, the arms get weaker, and they may not use them so much. And then the upper respiratory infections are common. Treatment, anticholinesterase. Will offer some temporary improvement. Glucocorticoids will suppress the immune system. Plasmapheresis will remove antibodies from the blood that might be causing a problem. A thymectomy may be done. I have seen limited cases of myasthenia. I've not seen the thymectomy being done, but your book does talk about it. In my experience, is not in adults. So, Huntington's disease. Huntington's disease is an inherited autosomal dominant disorder. It is carried on chromosome 4. Autosomal dominant. What does that mean to you? It means that they get it from one parent, only one parent, and that parent would have been dominant for it too. The issue is that it doesn't manifest until an individual is 40 years old or more. By then, they've had children already. So those children may have the autosomal dominant gene. There is progressive atrophy of the brain, particularly in the basal ganglia and the frontal cortex. There's depletion of GABA in the basal nuclei. Levels of ACH in the brain seem to be reduced. Okay? Huntington's, autosomal dominant. Signs and symptoms, mood swings, personality changes. There's a great video online, and you see, you can Google and find these, but the mood swings, the personality changes over time. The choreiform movements in the arms and the face. Their best diagnostic test is a DNA analysis now that we can do that and to find and recognize this deficit on chromosome 4. There's currently no therapy to slow the progression of this disease. It is symptomatic therapy only. Dementia. Dementia is a progressive chronic disease where cortical function is decreased. There are impaired cognitive skills, thinking, judgment, learning, memory, all are impaired. There may be confusion. There may be personality and behavioral changes. Lots of different causes of dementia. Vascular disease, infections, genetic disorders. You kind of see a pattern that so much of what we're talking about is related to the same potential problems. Alzheimer's disease, we've heard a lot about. It's a progressive cortical atrophy, neurofibrillary tangles and plaques, ACH deficit caused by loss of neurons. There is no diagnostic test available. It's kind of like you rule out everything else, and this is what you're left with. It requires a very careful history taking by the nurse, by the physician, by everybody who's involved, and then a psychological history to note when changes started to occur and what the changes were. Since the cause is unknown, we know that there's been some DNA evidence there with different chromosomes associated, but it is not known. Signs and symptoms extend over 10 to 20 years. Irritability, hostility, mood swings, gradual loss of memory, lack of concentration, impaired learning, poor judgment, decline of cognitive function, language, change in food intake. That becomes very problematic for a person with Alzheimer's disease. They won't recognize people. They won't recognize family. They don't know where they are. They may become incontinent. They can't function. They cannot function. I dare say that if you ask anybody in your class, that you've all had somebody affected by either dementia or by Alzheimer's. The treatment, there is none. Anticholinesterase drugs show some temporary improvement. All the therapies, again, occupational, physical, speech, all of the usual therapies. Psychotherapy is also important. Team approach for everything, right? There are other forms of dementia. There's vascular dementia, usually caused by cerebrovascular disease, as you can see here. Brain infarctions, probably in people more than 70, especially with, hypertension. It may be insidious onset and may occur and progress in stages. Other impairment is common. Creutzfeldt-Jakob disease. This is a rare but rapidly progressive disorder caused by a prion ingested or transmitted through contaminated blood. You may have heard of this disorder. It can be iatrogenic, caused from invasive procedure, surgery, corneal, anything that transfers the prions. Your book says it is most sporadic, has a long incubation period. Sorry, I'm moving around. There will be memory loss, behavioral changes, motor dysfunction, and as in the others, progressive dementia. AIDS dementia is common in the later stage of AIDS. The virus just invades the brain tissue. It can be exacerbated by other infections, by tumors. There's a gradual loss of memory and cognitive ability. Motor function will become impaired. Children with congenital HIV infection, the brain will frequently be affected, and there will be severe developmental delay. We don't see as many of these anymore. In Birmingham, we had a lovely baby's house, and that baby's house was for babies born with HIV or to AIDS infected parents, and the parents, of course, did not survive at that point, and the babies were all fostered. And so there would be 30, 40 babies in this home at one time. We took nursing students to rock babies and feed babies. Other mental disorders, this just a few more slides here. The DSM, the new one, I believe, is the DSM-5. The Diagnostic and Statistical Manual of Mental Disorders. You'll learn more about this when you do your mental health nursing or psych nursing rotation, and you will learn a lot about all of these disorders. But dysfunctions in areas of behavior or personality of the person is what happens here. There are biochemical or structural abnormalities that may be identified. There may be genetic components identified. There are lots of different illnesses that we call psychotic, schizophrenia, delusional, mood, anxiety, panic. There are lots of different disorders that could be classified here under mental disorders. Schizophrenia is probably one that we see a fair amount of time. There's a fair amount of the time. There's a variety of symptoms here. Every individual with schizophrenia seems to be a little different. That is true. There can be any number of different things that you can see. Common changes that you don't see visually include that reduced gray matter in the temporal lobes, enlarged third and lateral ventricles, abnormal cells in the hippocampus, excessive dopamine excretion or secretion, and decreased blood flow to the frontal lobes. Now, there are theories that it is a genetic predisposition to have schizophrenia, or that there was brain damage in the fetus which caused schizophrenia. There are grouped symptoms, positive and negative, and general symptoms listed for you here. Positive symptoms include delusions and bizarre behavior. Negative symptoms include the flat emotions, decreased speech. Generalized symptoms include disorganized thought processes, impaired communication, inadequate language skills, and delusions or false beliefs and ideas. These may be the folks that come in who believe that they are God. They believe all kinds of things. You will learn more in your psych rotation. Treatment is antipsychotic drugs and psychotherapy. The problem with the drugs is they do have some unwanted side effects. The extrapyramidal activity is one of the side effects, and the patients don't like it. And so they may not take their drugs as they should. Involuntary muscle spasms in the face, neck, arms, legs. You may see chewing or grimacing, jerking movements. Anti-Parkinson medication may help with the side effects. Add some more drugs. Depression is a common problem and often occurs in clients with a chronic illness. It is classified generally as a mood disorder with different subgroups. Unipolar is depression. Endogenous diagnosis based on biological factors or personal characteristics. Bipolar is what we used to call manic depression, where you have alternating periods of depression and mania. It can happen in response to a life event or maybe a systemic disorder, but it will be a swing from one end of the spectrum to the other. Results from decreased activity by excitatory neurotransmitters, norepinephrine, and serotonin. But the exact mechanism of depression is unknown. It is suggested that there is a genetic component, but it is identified by prolonged periods of sadness, loss of energy, no self-esteem, no motivation to do anything. There may be irritability and agitation at the least little thing, either insomnia or excessive sleep. loss of appetite, loss of libido, not interested in anything. The treatment is counseling. There must be counseling. It may be combined with antidepressant drugs that increase norepinephrine. It may be combined with SSRIs. It may be combined with serotonin, norepinephrine reuptake inhibitors, or tricyclics, or MAOs. And electroconvulsive therapy, which is the shock treatment, can be used for severe depression. I have seen that done, and I have seen it work. So it is still done. Panic disorders, panic attacks, sudden brief episodes of discomfort and anxiety. A panic disorder develops when panic attacks are frequent and prolonged. Genetic factors are implicated here. There can be an increased discharge of neurons in the temporal lobes, neurotransmitter abnormalities, and it's listed for you there, some of those. Signs and symptoms, episodes of intense fear without reason, without provocation. Can last for hours or minutes. It can include palpitations, tachycardia, hyperventilation, sweating, and the sensation that you're choking or smothering and you can't breathe. Treatment is therapy, psychotherapy, and drug therapy. Maybe anti-anxieties or antidepressants, depending on the situation. Okay, I believe that's it.